Hi, everybody. Today's episode of Healthy Tips for Tails has a little bit different format. I have with me a wonderful guest, Dr. Rob Erteman, who's a veterinarian in San Anselmo, California, who does very specialized energy work. And we work together with some patients. And today's episode is about Mr. W, a patient that we've shared. So Mr. W came to a household when he was about a year and a half old. He was attacked by an outdoor animal and he had severe damage to the front left leg. And after that, he could only use his front left leg from the elbow down. So that was his foot. In August of 2021, which was 5.5 years later, he's now 7 years old. All of a sudden, he could not use his hind legs. It was an acute episode. The people brought him to the emergency clinic, and after all of these tests, including with a neurologist, they did not have a definitive diagnosis. They thought maybe it was a clot, maybe it was a nerve damage from something in the spine, but they couldn't find anything. They treated him with prednisone, and while the client was deciding whether or not to do an MRI, he brought the cat home, and Dr. Erteman started seeing him then. I came on board a number of months later in October of 2021. Okay, what I'm going to do is show you a video. It's a short video, and this is a video when he first came out of the hospital, and then followed by a recent video that we took, and you'll see the difference. So here, let me just move this for a sec. Here's Mr. W. And you see he's not using that left hind leg at all. He's dragging in the front. This is him a little bit over a year later. And I want you to notice how he's using the front leg, the back legs, moving on that slippery floor and getting around really, really well. And this is him going up the stairs. And you see he uses each hind leg separately and that he's supporting himself on all fours. I'm going to stop the share and I'm going to turn it over to Dr. Erteman. Dr. Erteman, you're on.
Thank you, Dr. Schwartz. This client was a long-term client of mine who was familiar with my work, and his intuition led him away from pursuing an MRI. And so I started with working with Mr. W and started by doing a conventional neurologic exam to make sure that he had at least an exam that reflected his ability to recover. So he had pain perception, basically, but he had no ability to move those hind legs for himself. The work that I do has to do with giving him safety, fundamentally, so that he didn't have anxiety about his circumstances. So brought in a little safety and optimism for him, and then began working with muscle chain exercises, some of which had the function of basically energizing his spinal column and touching the cells on a level that they could start to regain some function. And over time, I brought in exercises for lateral, dorsal, and ventral muscle chains. And his nervous system was healthy enough that with the exercises, he was able to regain not 100% perfect function, as you can see in the video, but he has a very high quality of life without the trauma and the uncertainty of a surgical intervention.
And Rob, would you show us an example of an exercise that you did with him?
Okay, one of the exercises that I did, I'll give it a go here.
Mhm.
There's a muscle chain that runs on the lateral side of the body. It starts at the thumb side of the foreleg or arm for us and runs down the arm, the lateral side of the body. There are crossing points on the level of the upper pelvis, the diaphragm, and the collarbone. So those muscles are involved. And then it goes down the anterior lateral portion of the rear leg. And the stretch is very simple. We refer to it as the banana sometimes. And we bring the stretch into the side of the body until we can feel that it's in harmony. And then we wait 12 seconds and then we stop. So it's not about doing it the most intensely as possible. We don't want to create any kind of injury with the stretch. We just bring the animal into the stretch with sensitive hands. The proper point at which we stop can be felt. When there's the harmony in the chain, we leave it there to create a new muscle memory, 12 to 20 seconds, and then we let it go. And we do both sides.
Great. And I just wanted to make sure people understand that when Rob works with the animal, he's actually touching the animal and creating these stretches that we would normally do on our own. Rob does that with the animal, puts them in the position and holds it in that position, as he said. And I've been witness to this, and it's totally remarkable. So Rob and I work together because we feel that our work synergizes each other. And when I first saw Mr. W, I felt that there was a definite issue between the original episode where he was attacked in his front hind end, his front forearm and his hip. So when he couldn't move that whole leg, it was this whole side of the body. So Rob and I totally agreed. And from my point of view, I was looking at reestablishing connection using Chinese medicine. And Rob was using his formulas for reconnection. And I felt that the initial injury, the nerve damage in the front, actually blocked or strained the circulation going all the way down the side. And what we were looking at doing, and I was doing this mostly online initially, and I worked with his person, the cat's person. And in addition to finding where the major block was, which was around the shoulders and behind the shoulder blade, we did energy sweeps. And I did that using Qigong from my end and guided the caregiver in doing the energy sweeps along the lateral sides of the body. And he did touch and energy sweeps for a period of time. And I'm going to just show you that video one more time. And I want you to look at from there. Okay. So you see when he moves that the energy keeps getting blocked around the shoulder area. But I feel that the progress we've made and the feeling that this cat now has, both by feeling safe and in his movement with the human, that things have come a really long way. And I'm going to stop the share, put it on gallery view, and see if you have anything more to add, Dr. Erteman.
I think what I would like to just add is the quality of this cat's life improved remarkably, not just because of the improvement in his functionality after the event happened. But in this process, the owner was included and they became much closer. And the owner would say he's always been independent. But my feeling was he became closer to his identity, who he is. And again, the relationship with his owner became better. And I forget exactly the words of the owner, but he was really happy with what happened between them.
Thank you. I totally agree. And this is where the synergy of the energy work from any different direction and the human and the animal in the whole energy field benefited from this whole thing to help bring more peace to the world. Okay, thank you for this wonderful episode. And if you have any questions or comments, please just give it to us on the Patreon blurbs. And that's the end for today. Thanks so much.